Consent is one of the medical ethics principles that governs and organizes the relationship between the patient and the doctor. Similar to other medical ethics, consent is tremendously fundamental in both ethics and law. However, when working with patients, it is not enough to simply get approval from patients. Health professionals must seek informed consent. So what is meant by informed consent? The principle of informed consent entails that all patients have the right to receive all needed information and ask any questions they may have regarding the recommended treatments they are going to receive before giving consent or approval. This is necessary in order to make the right decisions about the type of medical care they will be offered. Successful communication in the patient-doctor relationship fosters trust, strengthens bonds, and supports shared decision-making. So consent from the patient, his guardian, or even his representative to the health facility or medical health professional is necessary in order to provide health care and perform all the necessary procedures to maintain the patient's health and assist in the recovery process. Informed consent has several conditions in order to be considered. First, it must be given by the authorized person, who in turn must have legal capacity. Second, the procedure of giving informed consent itself must be legitimate and follow the rules of the medical facility just as any other legal procedure would. Finally, consent shall be in the language that the patient can understand and recognize, and it shall be stated verbally in a direct and clear way. Medical practitioners who seek the informed consent also have certain conditions to follow and abide by. First, the medical practitioner shall be licensed to practice the profession and has the necessary qualifications to provide the specified services. Second, the medical practitioner's aim shall be for the benefit of the patient, and he should act in the patient's best interest. Finally, the medical practitioner shall not violate or exceed the boundaries of the medical consent, except in situations that threaten the patient's life. Types of informed consent according to the way of expression include 4. 1. Explicit verbal consent. When the patient informs the practitioner of his decision and says, "I give you my consent to perform a surgery or a certain examination." 2. Inexplicit consent. When the patient agrees on performing an examination or a surgery, the physician can go on with another essential procedure if he finds the cause of illness different to what has been agreed on earlier. 3. Signal consent. When the patient nods his or her head as a sign of approval or blinks eyes. 4. Written consent. When the patient writes his approval for any medical procedures, but he or she doesn't utter any word regarding that. However, there are certain cases where the patient's informed consent is not required, and that is because the consents are regarded invalid. For example, 1. Unconscious patients. 2. Mentally ill patients who cannot comprehend the benefits and risks of the medical procedure or give consent to it. Finally, it is important to highlight that the idea that sums up everything. Patients have the right to choose and can choose, whilst doctors have the duty to inform and can't oblige patients without consent.